We know that when we had all the childhood infections like measles, mumps, chickenpox, you never got two at a time. If you got chickenpox, you're not going to get measles while you have chickenpox, and that has to do with the body's defense mechanism. Once the body's infected, it puts out things like interferon, which keep the infections from spreading, and it helps the body kill the infection. If you then So you don't get two at a time. And they carried that reasoning over into bacterial infections and parasitic infections and yeast infections, along with the viral infections. So there's generally four categories of infectious agents: virus, bacteria, yeast, and parasites. I found that in chronic fatigue syndrome, many people had two or three, and sometimes even four kinds of infections at the same time. Remember, your intestinal lining, your gut, has about 3 trillion organisms of about 500 different varieties. And we don't know much about what's really going on in there. And so you could easily have a yeast infection and a parasite infection because we don't have the microbiology laboratory techniques to find this.
Wow. So it's really an exploration then in discovery of the underlying factors. How does this connect somewhat to your work with Lyme disease?
Directly with Lyme disease. A lot of the early sick chronic fatigue syndrome until you find the Lyme organism in the body. And when you find the evidence of the Lyme organism, it's Lyme disease. It's not chronic fatigue syndrome. It's chronic fatigue from Lyme. Lyme can cause serious fatigue, serious pain, serious neurologic debility, many serious skin disease. So Lyme is a very broad-based problem. And the Lyme itself we could talk about for hours, about all the different ramifications and the different forms that the bacteria take.
Because it can hit the brain as well, can't it?
Absolutely, absolutely. In fact, Alan McDonald, a pathologist in New York, found that he took biopsies from 10 patients who died with Alzheimer's disease at Harvard, pathologic studies on them, and 7 of those 10 brains had Lyme disease in it. Now, was the Lyme the cause of the Alzheimer's? There's not enough information to say that's so. To me, it's very suspicious because when people get Lyme disease, they often get early mild dementia, and sometimes it's even worse than that.
Well, when you say worse than that, would it lead to what might be categorized with symptomology of mental illness?
Yeah, absolutely. You get mental disease, and you get some of the classic mental illnesses like depression and anxiety, and certainly dementia. You get lack of comprehension. People tell me, I lost my IQ. I used to be able to figure out problems like that, just like, and now I can't do that anymore. And then the person has Lyme disease. There's in my mind a direct correlation.
So what would your treatment be once you would discover that a patient had Lyme disease?
Well, I use a lot of nutrients. I do everything I can to build the immune system to fight off the Lyme disease. And I've been doing that for 40 years. And I haven't found that I can be successful consistently doing that with Lyme disease. So I have to use antibiotics. And antibiotics is the standard treatment for Lyme. One of these drugs, doxycycline or azithromycin or amoxicillin, take one of these antibiotics for 15 or 20 days and you're cured. And they declare you cured. It's like you're being in a war, so I declare myself the winner. That doesn't mean that you've destroyed the Lyme organism.
Because it's kind of it hides, doesn't it?
Yeah, it's very hard to diagnose. I found that are consistently accurate in diagnosing Lyme disease. And these labs are often not accepted by conventional medicine.
Which are, name a lab, just so we can get an idea. Who would that be?
IGeneX lab up in San Jose, GENEX. But they're considered outcasts by conventional medicine. Whereas they have been examined and observed very carefully by the FDA on at least 11 occasions, and every time they passed the exam with flying colors. So they have been very, very true. They've been very effective.
Well, we know who's probably blocking that.
Right.
I mean, there's, you know, it's not a big secret.
It's the Infectious Disease Society of America. Yes.